if you really go back in time, a lot of the earlier testing wasn't done in any way, shape, or form like we would do now. It doesn't mean the vaccine is unsafe. It just means you're setting up your trial in a way to minimize the risk to finding a problem.
Now we've got a group of parents right now that are really afraid of the measles.
Mm-hmm. The very question is the right question that hasn't been asked. Who? Why? Who are the kids that we should be paying attention to?
Whatever is happening, it's not working collectively, right? We're not living better. We're not healthier. There's not more vitality.
1 out of 2 kids have a chronic disease. So if you want that for your kids, don't do anything differently. Keep going in the same direction that we're going. But if you do want your kids to be healthy, we have to do something different. And health has to be part of that equation when you make a decision.
Hi, everyone. So this week, I'm joined by Dr. Gator. And he's a traditionally trained pediatrician who's turned integrative thinker, which is key, thinker, who's asking the questions many parents are afraid to voice. We dive into his new book, Between a Shot and a Hard Place, and explore what informed consent really looks like when it comes to childhood vaccines. If you're a parent who's ever felt overwhelmed or dismissed even when trying to understand, hey, what's best for my child's health? This episode is for you. Dr. Gator breaks down the nuances behind the CDC's schedule, vaccine testing, and why so many families feel stuck between fear and trust. We also talk about how to strengthen your child's immune system naturally. Imagine that, regardless of your choices, and how to bring calm clarity to one of the most emotional and important decisions parents face. This isn't about fear or taking sides. I'm not into that. It's really about empowering you with the information that you deserve. Welcome to the Gabby Reece Show. Let's go. Well, Dr. Joel Gator Warsh, we're going to say it once fully. I might, just call you Dr. Gator for the rest of the podcast. Welcome to the show. I feel like we've tried a couple times and we had stuff happening like fires and just things.
I mean, even today, like the rains, everything, it's like we're trying to, some sort of nature thing was always happening.
Yeah. I woke up this morning and I didn't want you to spend half your day in the car. So needless to say, I'm so happy that you're here. Thank you.
Thanks for having me
really
here.
Means a lot. So you've written this is your second book, and I've read both of your books, and one was sort of about, parenting and doing things at your child's pace. And this next book that I really want to, I think it's really important because I think a lot of people are confused. They're scared. They want to make the right move. And so your self-published new book is Between a Shot and a Hard Place. And I think you're the perfect person to write this because of your credibility.
Thanks. I mean, vaccines are such a difficult topic to talk about. It shouldn't be. And even just a year or two ago, I really wasn't so comfortable talking about it just because there was so much censorship. In the first book, I mentioned some stuff about vaccines, but didn't really dive into it at all. But I really feel like we have to talk about it. We have to talk about everything. And vaccines should be no different. I'm not against vaccines. I think we have to have conversations. I think we need to listen to those that have concerns, and we want the best, safest products. And unless we're able to have conversations and have discussions and debate, then we're never going to get to a better place. We can't just keep having more. We can't just keep having companies run the show on this. We have to push back a little bit, and we have to listen to people and have to ask questions. And parents come to me all the time with questions. And when you see anything about vaccines, it's really very one-sided. I mean, you have books that are extremely pro-vaccine. You have books that are extremely anti-vaccine. You should never get one. And the truth, like most things, is nuanced, and it's somewhere in the middle. And there are so many questions that I have and that parents have, and we haven't even been able to have the discussions about them. So I do think it's time. And I think the world has changed a little bit in the last few months. So I think that's a good thing.
Why do you think, I think it's so fascinating because first of all, dealing with children and parents is one of the most sensitive things, period, right? Like when even if you talk about discipline or food or anything, people are very, they get dogmatic, it's just, there's not a lot of wiggle room, right? So you're seeing all kinds of families and parents in your practice and in California. What is kind of the traditional, let's just say, schedule for vaccines and for throughout a child's lifetime?
The recommended schedule in America would be the CDC schedule. And so, I mean, I don't know how much you want me to get into it, but there's a bunch of vaccines you get in the first year. So you get, if you're getting combo shots, the DTaP, so diphtheria, tetanus, pertussis, can be combined with Haemophilus influenza, polio, and hepatitis B, or you can have those separately. There's the pneumococcus vaccine, and then you have the rotavirus vaccine. You can also get a hepatitis B at birth. You get an RSV vaccine at birth.
Okay, so let's talk about, so it's about almost, is it 72 shots or some, how many is it?
So 72 is a commonly quoted number in terms of the antigens. So
okay.
It's not exactly true, and it's certainly not true anymore, because if you're including all the flu vaccines, the COVID vaccines, RSV, it would be more antigens. But so that's not the number of pokes you would get, because in each vaccine, or in some of the vaccines, they have multiple antigens. But 72 is kind of the coded number maybe 5-10 years ago for how many pokes, how many antigens you would have in the vaccines if you're counting like DTaP as 3 antigens.
Right.
It's still a lot.
Yeah. It almost, you said, okay, you can be in the hospital and get a Hep B. And this is a very hard thing. Would be, a newborn is not going to get hepatitis.
That is correct. Unless the mom has hepatitis B, then there really isn't a big risk, or really any risk, for a newborn baby to get hepatitis B. So the hepatitis B vaccine used to be recommended for high-risk groups, and then that changed to be recommended for all babies, more for a public health measure. Mm-hmm. But in reality, for a newborn, the risk is really low.
So if someone goes, I'm just thinking about having a baby right now, and they go, and especially if you're a first-time mom, you're scared, you're in uncharted waters, you're tired, typically, and then in comes the doctor to go, hey, we're going to do your vitamin K, we're going to do this, we're going to do that. You know, just as this feels like a really rudimentary starting point to talk about a vaccine. If I was this new parent, would you say, I would like to take a look at it? Can we slow down? Like, what would be the reasons for and against even just this simple one, which I think feels less controversial?
Yeah, so the vitamin K, well, first of all, vitamin K, the reason why we give it is it helps with clotting. And when you're first born, you don't have a lot of vitamin K. So there is a risk, not a huge risk, but it's there, that you could have vitamin K deficient bleeding. It's about a 1 in 10,000 risk if you don't get the vaccine. And if it does happen to you, to your baby, then of course that's a pretty big deal, especially if they have a brain bleed or a gut bleed, and oftentimes you don't catch it till it's pretty late. Mm-hmm. So they did introduce the vitamin K shot, and that decreased the risk almost to zero. So we definitely know that it has some good benefit, but just like everything else, the question that most parents have are at what cost? Now, I would say for vitamin K, of almost any of the shots that we do, the risk-benefit ratios are pretty good from what we know based on the research that we have, because it's pretty significant thing if you have a brain bleed for a baby, and we can get a vitamin K shot to decrease that. But I do think still you need to be having discussions. We need to be explaining this to parents. We need to be explaining the benefits, what the risks are. We shouldn't be assuming that just giving something has no risks or no long-term risks. And I think that those are the conversations that aren't happening. It's just like, just do it. It's just a vitamin. There's nothing in it. It's totally fine. And the reality is that there are ingredients in it. There are preservatives, unless you're getting the preservative-free form. So there are other ingredients in there. And whether those cause any issues, that's to be determined. But when you just give a vitamin K shot, that's one thing. But it's another thing to give a vitamin K shot, hepatitis B shot, an RSV shot, antibiotic ointment, and you could be getting all these in the first 1 or 2 days of life. It just starts to add up, where all these little risks could compound into smaller but somewhat of a risk. And I think parents are starting to be concerned about that.
And maybe for argument's sake, we could also encourage people that it doesn't have to be binary. You're not binary. It doesn't have to be either or. And there is something where they do talk about like slow medicine. Mm-hmm. And so maybe to give people some kind of vernacular about their just wanting to explore some of this and that they're interested in slow medicine? Because then it doesn't imply, hey, I'm against all this.
Correct. And I'm not again, I'm not against vaccines. I'm pro informed consent. I'm pro having discussions. I don't tell anybody what to do in my office. I have patients that do the regular schedule. I have patients that go on a slow schedule. Some people that don't want to do any. I don't force anybody to do anything, and I don't think we should. I think our job as a doctor is to inform about the benefits and the risks and the information that is out there to the best of our knowledge, and then let people make their own decisions. But what we are seeing right now, what I hear over and over again, is parents are getting more and more concerned because they don't feel like they can have the discussion, and they have a decreased trust. Trust is gone in medicine. They just don't feel like they can trust anything, and the finances are running things. The big companies, they feel like, are running things, and without having those conversations, then the hesitancy rates are increasing. And that's what we're seeing. There's the highest rate of children that are not getting any vaccines. There's the highest rate of kindergartners that are not fully vaccinated. Before the pandemic, 70+% of people looked at medicine and hospitals favorably. Now it's like 40%. People just don't trust healthcare anymore. And medicine is trying to decrease hesitancy, but they're actually promoting it, I think, because this push to not listen and not have discussion and debate is really the opposite of what I think most people want, which is not to have a product that's perfect, but to have an open, honest discussion about safety and just try to make them better. If there is some ingredient in there that is related to X, Y, or Z, let's try to figure that out and decrease those risks. Why would we not want to do that?
So I want to go, I have a lot of questions about the vaccines, are they tested safely, things like that. But before we do that, maybe you could just explain exactly to people your background, because I think it's important that you're coming from not only a qualified background, but also originally traditional, what we would call traditional perspective.
Yeah, I would say pretty traditional perspective. I mean, I grew up, I was not naturally minded, particularly at all. I grew up in Canada, played sports, was involved in all kind of that stuff. When my brother was growing up, I started coaching him in baseball and hockey, because of course you have to be involved in hockey when you're in Canada. And I just love working with kids. So I started working at summer camps. And so that was really, when I love science and working with kids, when I went to medical school, it was to become a pediatrician. Before I went to med school, I did a master's in epidemiology and health research, and had done some literature reviews and other research at that time on injuries and obesity. And that was a school in Canada, Queen's University. And then I went to a great medical school in America, in Philadelphia, Thomas Jefferson, and then did residency at a really, really great program in Los Angeles, Children's Hospital Los Angeles. But especially as I was going, later on in my career in residency, I met my wife at that point, my now wife, and she's very holistic minded. So that really did open up my mind to other modalities and just alternatives, and just really thinking in a little bit different way, and seeing chronic disease rates skyrocketing, and a focus on medications, and really no room for anything else. And so I started learning about integrative medicine myself, and that's really what got me here today. I'm not against modern medicine. I think it's amazing, and we have a lot of amazing tools and medications that can save your life, but we're so focused on that right now, and we definitely don't realize how ingrained pharmaceuticals and pharma has become in our training. And I don't think we have any idea how much influence they really have over our training and just our general philosophy on health. And so that's what really brought me to this point. But even still, I wasn't super comfortable talking about vaccines openly, because it just was so controversial. Obviously, we talk about in the office, but through the last couple of years and through COVID, I just got really frustrated. People have got really frustrated. I think at this point, the censorship has decreased significantly, and it is a time where people are more open to having these conversations, and it's time. And so when I decided to write the book, it's not about getting people to vaccinate. It's not about getting people not to vaccinate. It's just about having discussions and opening the debate and bringing this out from the shadows, and letting people talk about it, because so many parents, like, they don't feel comfortable talking about their friends. They're more comfortable talking about heroin or drugs than they are about vaccines. And
it's no joke.
It shouldn't be that way. There's no reason you shouldn't be able to have a conversation about a medical product and discuss your feelings on it. Why should we not be able to?
I know it is interesting, and I think it's been set up really well, where because it almost does feel like an ideology. So now it's like, oh, you're attacking my beliefs or my religion, versus we've always used discussion to try to figure out how to make informed decisions. Like, what do you think? And what was your experience? And a lot of that has gone off the table. So I really appreciate that, because people like me could talk about it all day long, but having someone like you come to the table to have these conversations and bring an informed and reasonable voice is really, really powerful. And also, I think for a lot of people, it gives them permission to say, I do have questions and I want to talk about it. So do you think if you hadn't met Sarah, your wife, wait, did you meet at a hockey game too?
We
Seems
did,
like
yeah.
you got a lot of hockey in your life.
Yeah,
hockey
Canadian.
has brought a
What are
lot.
you supposed to? We did.
How do you think your practice would be different if you hadn't met Sarah? Because I guess from the stories I read in the book, it's like her making you real food and you sort of going like, oh wait, I do feel better. And that you and her some of her ideas around naturopathic medicine, or just kind of a mixture of practices. It must be interesting, because your practice would probably be in a really different place.
There's a good chance that it would be. I mean, I would say it's hard to know, because I feel like I'm pretty open-minded and have always been. So I don't know that something else wouldn't have led me down this path, or I wouldn't have been frustrated anyways with the things that were going on and looked into it. But, probably not, right? I mean, the reality is, when you're in medicine, when you're in training, you're taught a certain thing, and you really never think in any other way unless you're exposed to it. And I just do think you need to be exposed to some of those other things to be like, that makes a lot of sense. Let me look into that. Why are we not learning that? Why are we not thinking about why? Why are we not thinking about root cause? Why are we not asking questions about vaccines? I mean, if we talk about what we learn in training, you don't learn about vaccine safety, not really, right? You learn about vaccines, which ones are on the schedule, what the schedule is, what the diseases are, but there isn't a lot of discussion about safety, and you don't really think about that till you look back on it. Like, it's just how it is. The same thing with nutrition. I mean, that's talked about a lot, but we don't learn a lot about nutrition in med school. We just learn about nutrient deficiencies and diseases and what to watch for, but not about how to be healthy and eat healthy. And that's just the way that the curriculum is, but it doesn't have to be that way.
Yeah, and you've been talking about that. What's your acronym? SEEDS.
Mm-hmm.
You've been sharing about stress, environment, exercise, diet, and sleep. So you've incorporated this into your practice. Your last book, you've been talking about kids' lifestyle, which it sounds funny, because before it was like go out and play. Cereal's probably not great, but we ate it, And I think is so interesting to me is we've made it so complicated that now we have to reinforce the basics just to kind of pull it.
Yeah, I mean, the statistics are staggering and scary, and I do think that with the chronic disease epidemic, whichever study you look at, whether it's 25% to 50%, somewhere in there, it's way too high. We have a third of kids with diabetes or prediabetes. We have over half of individuals are overweight or obese. I mean, the numbers are not getting better. And I do think it has come to a point where it's so noticeable that people are taking note of it. And that's why we did see this movement in health in politics. It's not political, but it was something that people got involved in politics that were maybe never anything to do with that subject, just because it is such a big deal. And I do think it's refreshing and good to see that we are having these discussions. It needs to almost be taken out of politics again. Like, I think it's good that it got in so that there is some discussion, but I think this has to be something that there isn't a Republican or Democrat or a Maha or whatever you want to call it. It has to be parents and individuals who want to be healthy, who are coming together and it's not political. So I just think we have to do that. But I think that because it got to a point where it was so bad, then somebody stood up and said, look, we need to do something about it. And that really caught some backwinds, and people really came in and were a big part of making that happen. And we're seeing the results, and we are seeing a lot of exciting things happening. I mean, it doesn't matter whether you agree with every single policy or every single thing, but of course we need to do something because there's a problem.
Right. And I think your timing is perfect. So let's just talk about the testing. Is it 1986-ish that all these pharmaceutical companies that make these vaccines, they're sort of, I guess they told the Reagan administration, we'll provide them for you, but we can't be liable. I'm oversimplifying, but is that sort of it in a nutshell?
That's correct. So around in the early 80s, there were a couple documentaries, and there was a lot more concern around, especially the DTP, the diphtheria tetanus pertussis vaccine, and potential complications with that, and neurologic effects, encephalopathy, those kinds of things. And so there were a lot of lawsuits that started to pop up, and certain vaccine companies left the market because they were getting sued too much. And one of the big, I don't know if you want to call it issues, but one of the big things that if you have a young, healthy child who has a serious reaction, that's a big deal. It's a big lawsuit. And those companies didn't want that. And so they were many of them were threatening to leave the market. Some of them did. And so the government basically enacted the law in 1986 to shield them from liability for the most part. I mean, it's pretty blanket liability shield, except for very specific like negligence and things like that. So yeah, around 1986, they lost their liability, basically.
Yeah, so 40 years we've sort of been in that. And I think most parents assume, you know what it is too? It's like it's wrapped in so much officialness. Like even these, these agencies like the CDC and the way your doctor is in the office. So I think for a householder, you go there and you're like, well, these people really know what they're doing and talking about, and there's all this protocol. But maybe we could talk about the actual testing for vaccines, because one would think this goes on for years and years, and we have, whatever, double blind, placebo, all of these types of things, but that may not be the case in some of this.
Yeah, it certainly isn't. I mean, even before we get into that, one of the reasons why I don't feel like I should tell people what to do, or certainly never tell someone not to do a vaccine, is because I think it would be a little bit arrogant to say, I know better than the CDC, or I know better than all of these intelligent people that have spent many, many years studying, researching, coming up with their plans. I think there's a lot of validity there to what they have done, but I think it's a certain model, and they know only specific things, and they have a certain mandate, and they're not always sharing all of the truth. They're not really looking into everything. And that is where I think it's now our time to start to ask questions, not to stop vaccinating, but to make sure that it's the safest it can be. And it also has been so long since some of these things have happened that I think A goes to B, goes to C, and a lot of the early stuff gets forgotten. And I think that's what you're implying with some of this testing, which, if you really go back in time, a lot of the earlier testing wasn't done in any way, shape, or form like we would do now. Pretty simple testing, not necessarily blinded or randomized, not necessarily placebo-controlled at all. And the more modern studies are done, more in a rigorous fashion, but they're oftentimes based on those earlier studies because they don't do an inert placebo, meaning saline or salt water. They often study the new vaccine against an old vaccine. And so it's really a comparison versus a safety test, because if the first vaccine caused issues, then you're only comparing those two with each other. You're not comparing it to a placebo. And that's how they can get away with it now, because they can say, oh, it's safe. But the question is, what's the baseline of safety? And a lot of the research we really don't have. Almost no vaccines have been studied in that way. They say it's been placebo-controlled tested. And sometimes even RFK says this, that he's not specific enough. So it's like really important for people to be specific. All the vaccines have been placebo tested. They've been studied against a placebo, but the placebo in a lot of the studies is actually another vaccine. So it's not inert placebo tested, which is what you would be looking for the best safety data. And most of these studies, you're still getting all the other vaccines. So if you're studying a new measles vaccine, you're studying a new one versus the old one in the setting of all the other vaccines.
If you had a magic wand and you as somebody who is saying, hey, can we look at this? How would you start to unravel the way it's been done and move it towards a direction, whether it's in the testing? What does that look like? Because you probably have a better understanding that. So it's not an all or nothing. It's like, hey, well, we could look at, they ram polio on us because it is the scariest. But I think if people do any homework on it, the reality was it appears that, it was, not clean living conditions, sewage and water. When they cleaned that up, when everybody moved from rural areas to cities, that sort of took care of it. And then a lot of the polio cases were from the polio that was injected into them after that. So it's like you have polio from dirty living conditions. And then it's like they cleaned that up and then the polio vaccine came out. So let's just take polio, for example. That's the big one. That's one of the big ones. Mm-hmm. Everyone goes, well, what about polio? And, what if they get polio? If you had your magic wand, how would you navigate polio and the polio vaccine, let's say?
Okay, so there's a couple questions there. So I think, first of all, like you said, one of the important things is to actually get information on these diseases, because the reality of polio is, yes, it is very scary because we all know about the paralysis and people not moving, but the vast, vast, vast majority of people have very mild symptoms, like 99% plus. So most people that ever got polio were either asymptomatic or had a mild stomach bug.
And don't you have to get it through, like, not to be gross, but like shit in your mouth?
Yeah, basically.
Right?
So that fecal oral route. So basically, like, someone doesn't wipe very well and you get it. So that is how you get it. Some of what you're alluding to, certainly very true. And it's not just polio, it's all the vaccines and all the diseases where the vast majority of the cases and the vast majority of the deaths were all gone before vaccines ever showed up. Sanitation made a huge difference. Yeah. So before, let's say, the 1950s, most of these diseases had decreased drastically. Certainly the death rate had decreased drastically. When vaccines came in for a lot of these diseases, they still did a lot for some of these diseases. A lot of them still had a lot of cases, and they dropped those cases near down to zero. But still, a lot of the death and a lot of the serious complications were gone before vaccines came into play. So I think that's an important factor to understand. Polio as a whole, we can go into polio for a while, but it's a really interesting conversation. And there are lots of books, even, I don't know if you've ever read The Moth and the Iron Lung, but it's a really good book that goes through some of the history or potential history of polio, because we really think of these epidemics from the early 1900s with polio, but they didn't have testing like they had today. They really just went based on symptoms. And there were many things that could potentially cause those symptoms, like mercury poisoning and arsenic poisoning and pesticides. So potentially some of those outbreaks could have been to do with some of those things, as opposed to what we think of as the polio virus today. Doesn't mean there isn't polio virus, but there's some sort of mixing there. So anyways, that's kind of the interesting backstory on polio. You can look into that. If anyone wants to another day, it's pretty mind-blowing to hear the difference. Isn't it
fascinating that we could hear something from 100 years ago, 150 years ago, and it rides right on through? Mm-hmm. It's like the worst game of telephone ever. It's like, it's so powerful how generation after generation, and Laird and I joke that a lot of times when that switch gets flipped and you become afraid, and I don't know of anyone who cares more about anything than a new parent. It just locks you into that
it is
trance.
And you do not realize how little we know about these things until you do the research yourself. Even me as a doctor, as a pediatrician, as an integrated pediatrician, the vast majority of what I learned was in doing the research for this book. There were so many things that I found out after that I just could not believe, because we're just never taught it. And, we can talk about autism later, but that is a whole other story of things that we can come back to it, but it's pretty shocking.
What's something, okay, but aside from autism, because that's the big onion in a certain way, what did you come away being like, wow, it's unbelievable?
Oh, the testing. The testing is unbelievable, because you really, if you go back in time, the earlier tests were really not done in a way that you'd expect them to be done today. Things like the whooping cough vaccines, you're talking about testing the new DTaP against the old DTP, which they took off the market because it was theoretically having too many problems. You're saying something that's safe, but you're comparing it to something that was so
Super
unsafe
dangerous.
that they had to take it off the market. So that's just a weird thing. When you look at the Prevnar testing, so Prevnar is for pneumococcus. When the first Prevnar came out, there was no vaccine on the market for pneumococcus at the time. So you would think that to get that approved, you'd have to placebo test it, right? You test it against an inert placebo because there is nothing else to test it against for pneumococcus. So the reason why they say they have to test, let's say, the old whooping cough against the new whooping cough would be because if you have a vaccine that is proven to be safe, proven to be effective, it's unethical not to give a child that vaccine. So you can't give a placebo, an inert placebo, because you have to give them the vaccine that exists. But with pneumococcus, there wasn't any other vaccine on the market, so there's no reason you'd have to give another vaccine. But they placebo tested it against the meningococcus vaccine. So there's only one reason why you would do that, right? The only reason you would do it is to try, most likely, to minimize the potential side effects that you might see. It doesn't mean the vaccine is unsafe. It just means you're setting up your trial in a way to minimize the risk to finding a problem.
Right.
So that, I think, is pretty shocking. And then when you really think about some of the safety testing, like hepatitis B, the original trials in the vaccine insert, there are 4 or 5 days of safety testing. It's a product we're giving to babies, and there have been, I listened to Del Bigtree talk about it, and they try to do Freedom of Information Act to try to find out what more information they might have had, and didn't really get anything more. But you would think that there was more safety testing done than just a few days. Obviously, there have been studies after that fact, but that was what it was approved based upon. And most studies are a couple weeks, a couple months, maybe 6 months, maybe a year if it's a really good study. Very few go beyond that. So to make any claims about long-term safety, you really can't do that because the studies just don't look at it in that way. Yeah. So that was the big shockers.
Did you? It's so funny because you have a very composed demeanor, and you're like, I was shocked. Like, I mean, it's not that do you lose sleep over it, because you have opportunities in your practice to give, people, they get to do what they plan that they want. But in a way, you're in this field. Do you go to conventions with a bunch of pediatricians and then try to talk to them about it? And like, how's that for you to navigate?
I haven't had to do that yet, so we'll see. Yeah, I mean, this is still fairly new for me. I didn't really talk about it too much until the last couple months. And I obviously know about vaccines, but I hadn't done the research till the last 6 months to a year. And so I think it's going to be very interesting for people to hear me speak about this and to read the book and then to see what that experience has been. I had several mainstream doctors that I know read the book, and they all still talk to me. So, I haven't lost any friends yet over it, but I make the joke. I'm like, read the book, but we'll see if we're still friends at the end. But we'll see. I mean, I can't imagine that the mainstream medical people are going to love this, but I don't know. I tried to approach it as scientific and evidence-based as possible. And I hope that in providing this information, it will open up people's minds a little bit. But with vaccines especially, it seems very, not even political, like you said, like it's like almost religious. Yeah. And maybe seeing some of this stuff will make people ask questions. Maybe not.
This podcast is brought to you by Ritual. I've been taking Ritual's multi since COVID started. I am low in vitamin D. A good friend of mine shared with me about the brand. I did my own homework, and I've been taking it ever since COVID hit. First off, we know that most of us, something like 97% of women ages 19 to 50, are not getting enough vitamin D from their diets. You can try. It is really hard to do. I get outside all the time. It's hard to get enough sun. And Rituals Essential for Women 18 plus was shown to increase vitamin D levels by 43% in a clinical study. So I just take it in the morning. It's really simple. I take 2 in the morning. It's easy on my stomach if I haven't eaten. You don't have to like coordinate it around your foods. They also have other incredible things like for your gut. They even have some proteins. So they take ingredients really serious. A clinically backed multivitamin for women 18 plus with high quality and traceable key ingredients in clean, bioavailable forms. That means your body knows what to do with the ingredients. They take 9 key nutrients in 2 delayed release capsules per day that optimize your body's absorption. So again, your body understands what the ingredients are and you actually get to utilize it. Like I said earlier, it's so gentle on an empty stomach with a minty essence, so you don't get those weird vitamin burps. Every bottle that helps take your vitamins just really pretty easy and enjoyable. So Ritual's multivitamins are vegan, they're non-GMO, they're project verified, gluten and major allergen free. They're even certified B Corp. And again, all the ingredients are made traceable. So no more shady business. Ritual has got your back. Ritual's Essential for Women 18 plus is a multivitamin you can actually trust. You will get 25% off your first month for a limited time. And all you have to do is go to ritual.com/Gabby. You can start your Ritual or add Essential for Women 18 plus to your subscription today. That's ritual.com/Gabby for 25% off your first month at ritual.com/Gabby, Gabby. Sometimes I can't help but think about it. And I had some friends that went through this in COVID where, they're busy, they're working, they're traveling. They get the COVID vaccine, and several of them had interesting and different reactions, right? And what's interesting is you'll see people respond in one of two ways. They either double down or they go, oh, I got to take a look at this. So what if I'm a parent that I was doing the right thing? I was doing what my doctor told me. I was doing what was available to me. And maybe I did notice something, whether it's a rash or something more that with a kid. I guess what I'm interested in is also having a sensitivity to if somebody was just doing the best they could at that time, as we all do, and then we get new information and we want to adapt. Mm-hmm. And this is a tricky one because it's your kid, you've put something into their body. What are the opportunities for a parent to reinforce and move their kids into a lifelong path of health? Because, this is also the question that I think is important, which is to support all the parents. How do we help them? What are some things that we can do that would just reinforce good health if, let's say, a kid did have a reaction to a vaccine?
I think it starts with having these kind of discussions more openly about vaccines. And that's why I wanted to do this, because you have an endless array of stories at this point from parents who say that they got a vaccine, say that they had a reaction, and then are kind of dismissed. Yeah. And, if there's one thing that I've learned in practice, it's to trust moms. I mean, dads too, but moms have a special bond. And there are all of these moms that say X, Y, and Z happened. I gave my kid a shot. This thing happened the next day or the next week. And these parents have no reason to lie. They literally went in to get vaccines. So they're not anti-vaccine. They got a vaccine and they swear that something happened. Now, does that mean that every single time it was because of the vaccines? Of course not. Sometimes you're going to get a vaccine today and have a heart attack this afternoon and it has nothing to do with it. But there are just so many stories at this point that and it doesn't even make sense that you wouldn't have reactions from vaccines. Like, that makes no sense. You have reactions from everything. So why would it not be possible with vaccines too? But these are parents and families and situations that we have to learn from. And we can't dismiss it. We have to start to understand who's having reactions, what reactions are they having, to try to start to minimize those things over time. Nothing's perfect, and no vaccines are going to have zero reactions. But as we add more and more, and we have more and more people coming out and speaking about the things that have happened to them or their family, we can move forward in a better way by listening to those people, using that as information and data, and trying to pinpoint, is it some ingredient? Is it the timing? Is it how many we're doing? What kind of reactions are we seeing that are kind of the tip of the iceberg, that maybe this kid had the rash and that was a rash that was from the vaccine. So maybe that kid is more sensitive and maybe that's the kid that should go slow, or maybe that's the kid that shouldn't get any vaccines, or maybe they should wait 2 years before getting vaccines. I don't know what the answer is, but if we don't ask the questions, if we don't have the discussion, if we don't come from a lens of safety and not kind of put vaccines on a pedestal, but say, they work great for most people, but who are the subset of kids that are vulnerable, and can we pick those up and can we minimize it, or can we figure out which ingredient or what ingredients or what we're doing that's triggering that autoimmune condition or triggering the heart condition or whatever it is. And we're definitely not doing that right now, like not in any significant way. There's certainly, you have VAERS, we have the vaccines,
which is hard to report. Right? Like they make it very difficult even for the doctor to report.
So you can report it. I mean, it can be, but the problem with it is that it's a self-reporting system that requires you to make an association between the vaccine and the symptoms. So number one, not everyone reports it even if they think so. But let's just say you had a vaccine today and you got cancer 10 years from now. You're not going to put those two things together. So who's reporting it, or how do you even figure out that there is some sort of association? If your kid develops asthma when they're 3, how do you know it has anything to do with the vaccines that you got 3 years ago? Like, you just don't know that. The only way to figure that out is through prospective studies. And we don't do that. We don't do that at all. We don't follow these kids for a long time. We don't do vaccinated versus unvaccinated studies. And you have to do that.
We don't do those studies?
None. So we don't follow kids forward.
It makes me think about, like we were just earlier joking about the measles, right? I had whooping cough and chicken pox when I was a kid. And now there's an outbreak of measles, and there was online a joke about the Brady Bunch showing it on TV, and the kid's like, "Yay, I get to stay home." And they're like, "Yeah." And then in modern day, some Law and Order, like everyone's going to the hospital, and it's this whole thing. So, if I'm listening to this and I think, okay, well, why? I mean, now we've got a group of parents right now that are really afraid of the measles. And they'll say, well, there's people in the hospital and dying. So I guess how would we talk about, because I always honor where people are coming from, but how could we put this into sort of perspective about some of this stuff? Like measles, mumps, are these the worst things in the world? And rubella is what, the German measles? Correct. It just has a weird name. So I guess for me right now, that's timely talking about measles. How do we go from that 60s, 70s to, oh my God?
I believe over the last, I don't know, maybe decade, but certainly around the time of COVID, we have become a society. The media loves to name diseases, loves to make us afraid of diseases. I mean, we had COVID, and then there was RSV, and just over the last few years, these things that have always been around, that we get a kind of a media frenzy around certain things. And measles is good to be aware of. I mean, you don't necessarily want your kid to get measles, but the reality of measles is it's in general very mild. Most kids get a cold. Back in the day, there were millions and millions of cases and only a few hundred died, versus now, flu, we get tens of thousands of deaths every year. So if you put it into perspective, it's not necessarily much more scary than any of the other diseases out there. The difference with measles, obviously, you have a vaccine, you can prevent it. And measles, the biggest concern, and the reason why medicine's scared of it, is because it's so contagious. I mean, measles is the most contagious, or one of the most contagious diseases that we have. And so if you're in a room with unvaccinated individuals, almost all of them are going to get measles if one person has measles. And over a population level, if thousands and thousands of people get measles, then some people are going to die. Some people are going to get sick. You certainly can go to the hospital. Pneumonia is the biggest concern with measles in general. And so as a parent, as an individual, I don't think you need to be overly scared about measles. I think it's good to be aware. We do have a vaccine that works extremely well, so that's a good thing for measles. The MMR works really well. It's very effective, like 97%, which is more than most of the other vaccines even. But
is there a risk? I mean, of course, everybody's different, right? So there's always a risk either way, right?
Correct. So the risk from the vaccines, I think, is the piece that's missing to make a true risk-benefit analysis. But at least for measles, we know a lot about that disease. We know how deadly it is. We know how severe it is. We know how contagious it is. We know what your risk is, and we know how effective the vaccine is. So those are the facts that we have, and we know the safety information from the vaccine to what we know. So you can only make a decision based on what we know today. I can't tell you what I don't know,
right?
But the questions that we have to be asking are about those unknowns, because the big question with measles is, okay, well, what is the risk from the MMR to you? Right? That's the big question, because if it has zero risk, then everyone should just get it, right? But if it does have a risk.
Why do they bundle it? Like, what is it? Not only preservatives, but I never say this right, adjuvants. Maybe you could talk about those two things, because the other thing is they bundle everything. And doesn't that increase, that makes it a little trickier instead of if you just got just the measles vaccination. And I know it's more pokes and more crying kids. I get it, why we do it, but that part is, people don't realize what else is in the vaccines.
Yeah, so there are two different questions there. So the first part about them being together, they used to be separate. They just stopped making it that way, probably just because it's easier and cheaper, and for whatever reason. I'm sure it was a financial reason, but they just stopped making it separately. So it used to be measles, mumps, rubella separately, just like diphtheria, tetanus, pertussis were initially individual. They put them together. Financial, but also just like you said, it's easier. More people are likely to get it. If you have 3 pokes versus 1, that's just a lot of pokes. So if they can get a vaccine that works based on the research just as well, then why not put them together? I think they for sure should have a measles standalone vaccine. I think people would potentially get that are hesitant, but they're like, there's a measles outbreak, I want to do it. So I think they should bring that back, but they don't have that available here right now. So that's kind of what there's not a really good reason. I think it's just because they can, and it just minimizes and simplifies things. In terms of the ingredients, so there are all sorts of ingredients in all different vaccines, but the biggest one that's a concern would be the adjuvant, so like aluminum, where they have, and then that's not in the MMR vaccine, right. but the adjuvant that helps the vaccine to work. So mostly for the vaccines where it's not a live vaccine, so they're just giving you a part of it, a protein, then to help stimulate the immune system, they put something in there to make it more effective. And so usually that would be aluminum. It used to be mercury thimerosal, but now it's aluminum in the vaccines.
Aluminum. So someone might be listening and they go, well, when we talk about reaction, what are things that would sort of be classified as, just for parents if they're on the lookout, mild reaction versus obviously a more severe reaction? The mild reactions that are documented in general, the things that I would see in the office would be pain, of course, if you get a vaccine, a little bit of a rash, swelling, a bump, fever, not feeling well, muscle aches, pains. If you've had a vaccine, like you just don't feel well for a couple of days or maybe a day, that's pretty typical. The atypical things that we would see more typically, so like atypical, but still enough. Seizures is probably the bigger one. So like a febrile seizure, encephalitis, so swelling, inflammation of the brain would be quite rare. Guillain-Barré syndrome is a neuron condition. So that could be something that we see with rotavirus, the oral one, intussusception, so blockage in the intestines, something that we see. So all these are quite rare, but those are the things that are documented as related to the vaccines. And then most of the other things are not technically related, but people are concerned. Right. If someone has a child that has if you in your practice have seen kids, is there a group or are there kids with certain things, certain allergies or certain conditions that you'd say, absolutely, you've got to pay attention to getting vaccines because this kid, because they have X, Y, or Z, is more vulnerable?
I would say the most vulnerable would be somebody who's had a vaccine that's already had a reaction. I think that's where we should be paying the most attention. But the very question is the right question that hasn't been asked. Who? Why? Who are the kids that we should be paying attention to? because it's not so simple because, like, for example, let's take someone with asthma. One could say, well, that kid has asthma, they're more sensitive, so we should go slow with vaccines. But then another person would say, well, that kid is more sensitive, so they're more likely to get very sick from a disease, so we need to make sure they get their vaccines. So both of those things are topics of debate, right? And so it's not always clear which direction you should go. But the regular schedule says you should vaccinate them normally because they're more susceptible. I think the questions that need to be asked are, if you have an autoimmune condition, if you have any sort of condition, any sort of child that has anything, are those the kids that are more susceptible to having a reaction? And are those the kids that we should be paying more attention to and going slower? And it doesn't mean they shouldn't get their vaccines, but maybe those are the kids that you just do one at a time, or you bring them back a little bit more, or I don't know. I mean, I don't know what the answer is, but to me, logically, a child who's very sensitive, that is a child that you should be more cautious with. And that doesn't necessarily mean they have to do any fewer vaccines, but maybe you just do one at a time, or you bring them back. I don't know. There's a few studies out there that kind of look at this, but not really. Again, it's like, this is what we have to study. I don't know what the answer is. Maybe there is no difference, but maybe for all the kids with an autoimmune condition, if they got one vaccine at a time, they would do better. They'd have fewer reactions. And if a study showed that, then of course doctors would say, okay, let's give these kids one at a time. We don't want them to have reactions. Doctors don't want to cause a bad reaction in kids. They don't want to cause an autoimmune condition. They don't want to do any of that.
Right.
So they just don't have that research. We've been taught that they're safe.
Right. Safe and effective.
They're safe and effective. And, that's propaganda. It's not reality. It's really unfortunate. But I believe that sentence is what was the biggest factor in losing people's trust during the pandemic, because what should have been said was, based on the research that we have, this vaccine, the benefits seem to outweigh the known risks. There's nothing wrong with saying that, because that's truth. If you say something is safe, that's new. You can't know the safety profile 10 years from now or 5 years from now. So you're making statements that are clearly not true, and people saw that, and then they just stopped trusting in medicine. And we've lost people's faith because there's a lack of honesty and a lack of saying, I don't know.
I know, it's funny. I'm more comfortable when someone says, I don't know, than when they are acting like they have all the answers. Like, even as a patient, I'm way more comfortable with my doctor saying, on this, I don't know. We'll take a look. I think they somehow are supposed to be this omnipotent authority that then just tells people, like, oh, you have to do this and that, when they don't realize that. I think a patient appreciates, I don't know.
Right. And especially with a vaccine or a disease, you don't know the future. So, I mean, I make the joke a lot in the office, but like, I don't have a crystal ball. So if you are the family and your kid's going to get measles and die, yes, you're going to go run and get the measles vaccine. But if you're also going to be the one kid that's going to have a super severe reaction, you wouldn't want to do it. We don't know the future. So we don't know. And there is a risk. And you have to decide based on what you know, what you think the best decision is for your family. And that's the information that we need to give people, and try to just get more and more information to understand the risks from the vaccine so people can make an educated, informed decision. Because right now you see things like, you give amoxicillin for, I don't know, a strep throat, and the kid has a little bit of a rash, maybe a little hives, and you're like, okay, never give amoxicillin again, right? And then you get a vaccine and the kid has a seizure, and you're like, oh, you can get your vaccines again, just wait, right? It's a very crazy double standard that it's just like, why can't vaccines cause a reaction for some kids? Of course they can. We just have to figure out which ones and why, so we can minimize that.
So on a rudimentary level, if you've had a patient comes in and they've had stuff, would a reaction to a vaccine, how do you go about saying, hey, we're just going to reinforce your system to the best of our ability? And we talked about seeds, stress, environment, exercise, diet, and sleep. So you reinforce lifestyle, real food, movement, get out in sunshine. Do you do anything even for little kids to either do their blood tests or reinforce their gut or things like that just boost bring buoyancy to their whole system?
I think that's always a reasonable thing to do. I mean, there's no harm to boosting a kid's immune system and making sure that they're eating healthy and sleeping as much as they can be. And yeah, I mean, for kids that are more sensitive, parents tend to do vitamins like vitamin D and vitamin C, zinc, just making sure that they have all the nutrients. But again, it's a good question that doesn't have answers that I wish was asked. Like, what can we do to support immune systems to decrease risk of having a reaction? Like, that is a very simple question that we should be asking. Are there supplements? Are there herbs? Is there testing? Is there a certain genetics? I don't know the answer, but I'm sure there are things that we could be giving kids before they get a vaccine to minimize their risk to getting a reaction from those vaccines. But you have to ask that question. You have to first say that there could be a reaction. Once you say that, then you say, okay, well, how do we minimize that? These are the steps that we have to take to get to a better place. And until we are able to have that discussion and debate, we're not going to get there. We're just going to get more vaccines and more reactions and more frustrated parents. And you're going to continue to have these, I don't know, growing factions of people that just say, just do it. And then factions that are never going to do anything. And that doesn't help anybody, because we need to work together, I think, for the kids. I mean, it's for them, it's for kids. We want healthy kids. There is no side. We just want the healthiest kids. And everybody oddly wants that. They just have very different opinions of how to get there. But nobody wants to create a problem for our kids. And I think we just have to ask these questions. And if we're able to ask the questions, then it may turn out to be that vaccines are the safest thing that's ever been created and we can just do 10,000 of them. But probably not, right? Probably there's some maximum limit of safety. And we need to figure out what that is for them, so that they can live longer and be healthier.
Yeah. And you know what it is too, that I really just kind of in a common sense way, whatever is happening, it's not working collectively, right? We're not living better. We're not healthier. There's not more vitality. People have never been more ill. And so let's just figure that out together. Like that, I think that for me, it's instead of banging on like this is the way to do it or that way, it's just going, hey, it isn't working. We've tried it this way. We collectively should try it a new way.
And I think it's key to talk about that, because the counterpoint that people always make is, oh, well, we're living longer now. And that is true, right? It is true, right? We are living longer. So yes, there are things that we have done in modern medicine and in sanitation and all these things that have made us go from 40 to 70 or 80. So that's good. But now in the last few decades, life expectancy started to go back down. Chronic disease rates went up. And so we have to have some humility here and say something or many things that we're doing are not working perfectly. We don't have to throw everything out, because not everything is bad. Some of modern medicine is very good. Most of it is good. But there are things that we're doing, and maybe we have to go backwards on a few things. And maybe not everything that we're doing in modern medicine or modern health is perfect. And let's have a little humility to say what's working, what's not working, and find some middle ground there, so that way our kids can live longer and we can decrease chronic disease, and we don't have to die from infections. We don't want to die from infections either. We don't want both. It's almost like it's an either or. And it's like, oh, well, you just want everyone to die from measles? No, I don't want anyone to die from measles, but I also don't want anybody to get a vaccine or take a medication and have some sort of terrible reaction. We don't want both. Both things can be true, and we have to find a happy medium. And it's not like a vaccine never caused an issue. We took vaccines off the market because they do. So let's go from that perspective of finding a middle ground. It's not either or. It's not we want people to die of diphtheria. Like, no, we don't want that either.
I know. I love the herd health. What about herd health? You'll get that one a lot. So I have to say, in writing this book, like, what was the hardest part? Well, first of all, the fact that you just, you're questioning, you're listening to patients. I would imagine that was the true inspiration behind this, was having enough patients and parents and moms saying, hey, I'm seeing some stuff. What was the most challenging thing about writing this book for you?
I think the most challenging thing was the understanding of the stuff that I was finding that I didn't know, and realizing how little people actually, like doctors, would probably actually know about this stuff. And you're prescribing something, you're doing something every day, and you really don't have a foundational knowledge that you feel like you do. It's more just you're told that it's safe and you just assume that that's true. You don't really have any reason to question it. And going through, I mean, that like you said, like one of the impetuses to write the book, it really was, I'm getting these questions all the time and I don't know the answers. So I was curious what they were. and I really did not feel good about doing shows like this and not talking about vaccines. Like it just doesn't make sense. Like writing a book for kids and then just being like, well, I'm just going to skirt over vaccines. I'll just put a little bit in there, but I'm not going to really talk about it. It's like that just got to the point where it makes no sense and it's not serving our kids. And I just had to get to the point where there was an understanding of what might be to come from that. And it just is what it is. And hopefully people will take to it well, but it is what it is, I guess. I don't know.
I think tonally you're a representation of where it's all going. I just think enough people are saying, let's just have these conversations. And it's already, I think people feel overwhelmed, right? We hear how our water isn't good, our air is full of stuff, and our food's not clean, our soil has stuff, and there's hormones, and there's pesticides and herbicides and all this stuff, right? So I think people are scared and they're overwhelmed. Because if you say to them, hey, like, just feed your kid one thing I love that you talked about, you were talking about even foods that are healthy in a pouch. It's like, hey, listen, it might be better, but it's still in a pouch, right? So for parents that are already overwhelmed and busy, this does feel like a lot. So for you to be willing to have the conversation, because parents do have the questions.
They do, and it is a lot. I mean, it's a lot for me. Sometimes it's just like, what do I drink? What do I eat? I don't know. But I mean, most people do fine. So I think at the end of the day, you just eat as healthy as you can and you get the best products that you can. But where vaccines are different is this is something that we have a choice. This is something that with food, it's like you have to eat every day. You have to eat something. You have to get food from somewhere. The world is what it is. You can't change the air in your environment, other than if you get plants, but you can't really change the air. But a vaccine, we do have control over that, and we do have the power to discuss it and make a difference and make a change if a change should be made. Mm-hmm. And I think that's where parents have this real difficulty because they have a beautiful baby, super healthy, and you're saying, all right, well, let's give them 6 vaccines today. And they're scared. They read things online. They read stories. They heard from their friend who had a bad reaction. They hear things. I mean, we have an internet now, so they've heard the crazy stories, the worst case scenarios, and they don't want that to happen to them. And they have questions, and they go talk to their doctor, and their doctor dismisses it. And that shouldn't be acceptable. We have to discuss the reality of things and then move from there. I mean, think about cancer drugs. Cancer drugs have all sorts of side effects, but people still do it because it protects them and might save their life. So the vaccines don't have to be perfect for people to do it. We just, I think, want honesty.
Yeah. And
I feel like a lot of parents would do it that are hesitant, but don't want to do it anymore because they don't trust that the authoritative bodies even care enough to study these things in a way to ask the questions like you asked before, like what do we do moving forward? We didn't really get there, but we have to study it. Like we have to study things going forward. It can be done. There are ethical things involved, but we can study vaccinated versus unvaccinated kids through choice of parents. Like people that are choosing not to vaccinate, they could be part of the study. There's going to be some inherent differences there, but it's still information that's useful. So yeah, we can do it and we can study moving forward and we can ask these questions and one thing at a time, start to figure out some of these things. We're not going to know it all tomorrow, but I would hope that in 10 years from now, we would know a lot more about vaccines and a lot more about vaccine safety. And we would have a lot more strict standards for new things that come on the market. Because if we don't make it more strict, the companies know how to play the game. They know how to play it better than the government and the authoritative bodies.
Sure.
They know how to rig the system. They know how to pay their way through it. And we have to set up some boundaries there so they can't just keep getting vaccines on the market that are unsafe. We want them to put safe things that protect us that we need. And also we have to have ethical and philosophical questions about how many vaccines do we want? Because just because we can make a vaccine for something doesn't mean that we should.
Yeah.
And just because we can protect you from a disease doesn't mean that we should, right? Maybe you should, but if we're going to have 1,000 vaccines, 100,000 vaccines? Like, at what point is it going to be a problem?
Yeah.
Or are we there?
And without I am putting you on the spot and you don't have to answer, but is there a vaccine that you just think for the most part, like, why bother?
I don't know if I'd say why bother, but I think that when I talk to parents, it's about risks and benefits from the disease. And so like things like hepatitis B as a newborn. If you don't have hepatitis B, then the risk to your baby is pretty small. And a lot of people do choose to not do that. Of all the vaccines that people choose not to do, that's probably the one
It is, yeah.
That people delay to later because there's just a very, very little risk to your child. It's more of a public health thing.
This podcast has been brought to you by Laird Superfood. I can talk about Laird Superfood all day long because it was created in my kitchen almost 10 years ago now by my husband, Laird. And it is a brand that I work on daily. We're part of the innovations, part of what's SKUs are coming next. I'm really excited. We have a new instant vanilla latte. All you need is hot water. We've got a nice organic Peruvian bean with that. That's low acidic. And we've got greens and we have functional mushrooms. We even have single serve ingredient mushrooms. So no matter what you're looking for, I'll just share with you what our guardrails are. So starting out with ingredients, and this really comes from Laird, high-level ingredients. And of course, we don't use artificial flavors, but we don't even use natural flavors. And this is something that's actually pretty hard to do if you want to do a food brand. Second is experience. We don't want you to have to sacrifice anything. It tastes amazing, makes you feel great. And yes, it is better for you. And third is we want everything to have a function. So we want the drink to support you in a way, but to have a real function. So for example, a lot of our creamers have adaptogens. We've got greens. We have hydrate. You got to try our hydrate. It's freeze-dried coconut right at the source. All you do is put it in water. Great. Taking the kids to soccer practice. If you're working out, because I know you are. We really try to think about you throughout your day. And then finally, cost. We do our best to really keep costs down and bring you the highest quality products that we can find that taste amazing, that make you feel great, that you can use throughout your day, but also to make it reasonable. So this is something, if you said like, oh, is it your baby? This is definitely one of our work babies. And our family uses it every day, and we're so proud to share it with you. And if you've never tried Laird Superfood, head to lairdsuperfood.com. That's LAIRDSUPERFOOD.com. And if you see something you like, go ahead and put in the code GABBY20, GABBY20 for 20% off your entire order. Now, I will say this, if you're a coffee fanatic, you should try our coffee. We're really known for our creamers, but our coffee is so good. And we have got coffee blends with adaptogens in them. We've got whole beans, however you take your coffee. So if you're interested, head to lairdsuperfood.com and don't forget the code GABBY, GABBY20 for your savings.
So I think that one.
Okay. And we're going to move off the vaccines. I have some other stuff I want to ask you, but one of the hot ones that everybody always talks about, and to be honest, this is the one that really got my attention because I had a lot of friends when I was getting ready to have children, especially their sons that were diagnosed with autism. And, I don't know if it's the testosterone, okay, some of it's genetic, some of it's environmental. A few of my friends that are parents were like, no, it was like a switch that went off in my son, and from one day to the next, looking at you in the eyes and not looking you in the eyes. So, and then the argument is, okay, we're better at diagnosing autism. So instead of it being 1 in 10,000, now it's 1 in 36. But for you in this dance, what do you think is going on?
Well, we didn't move very far from vaccines. We moved over to autism, but
we'll move away all the way in a little bit. We'll talk about computer screens and resilience. But
I like it. But we can stay on vaccines for as long as you want. It's just what I'm talking about these days. So it's another. I mean, of all the topics when you come to vaccines or all the topics in health, autism is probably the most controversial because it's happening so frequently and people don't have a good answer to it. And there's a very to me, odd pushback that it's just better diagnosis, which makes no sense. I mean, yes, there of course is a better diagnosis. And yes, of course, a part of that is we're more aware of it and we're diagnosing it more. But you don't go from 1 in 25,000 to 1 in 250 in 2000 to 1 in 36 to 1 in 22 in California just because of better diagnosis. That's just part of it, but it's around more. Like very few people remember autism or other kids with autism around them. It was around, but you just don't remember it just a few decades ago. And now it's everywhere. And you see it in every classroom, and you see people that are autistic all of the time. So it's absolutely happening more. There is no question that it is happening more in my mind. And I think that it's really frustrating when people just try to say that it's not happening more. And I don't exactly understand why, but we want to figure out why there's this increase, especially for the kids that have severe autism. Yes, there's different kinds of autism. It's a spectrum.
Right.
And certainly there are a lot of adults that were never diagnosed that were mild on the spectrum. And so they, didn't have their diagnosis. But there are a lot of kids that are nonverbal, that are stimming, that are harming themselves, like that really difficult for families. And they would want to do everything possible to minimize those symptoms. So why it's happening more, we just don't know. I mean, that's the unfortunate part. We really should have large scale studies figuring out the top things going on. The leading theories are genetics. And I'm sure there are some genetic components to it. There is no question about that, but that still doesn't make that much sense to me, that it's mainly genetic, because it's changed so much over the last few decades that it has to be environmental. It's probably environment mixed with a certain genetics, but I think there are a lot of things that we call autism, chemicals and toxins and prenatal exposures and all sorts of things that could lead to what we call autism today. But I think it's probably many things, and it's kind of a catch-all for a variety of different things. Some totally genetic, some totally environmental, and everything in between.
Yeah. I mean, I've had friends who, even 20 years ago, like fecal implant, and like their son Bo would be sissing all the time, and then that would really work. And for a while, like so many interesting things. And my friend, another friend of mine used to talk about where sometimes, because a lot of these kids, let's just say they're in there, right? They're just not able to communicate, but they're in there. And he'd say, that they were encouraged to try to bring him out of this tunnel as soon as possible. Like the younger, the better, through nutrition, like no gluten and all these other variables that they were doing. But I thought it was really interesting to watch people, because people don't realize it's not just the kid that goes through it, it's the whole family.
Right.
And how hard that is on the family. Now, I have to ask it, and it's completely separate, but these telepathy tapes, when they all meet on the hill, have you heard this, right? So my friend, I asked, Laird and I were listening to it, and then he asked our friend if he had heard this, and he said that his son, who is a young adult, goes, he has a hill that he goes to as well. So it makes me think too, like, it is the weirdness that is the poison of our environments and other, but then you also go, oh, is this also a group that somehow almost like transcending like us in a different way?
Yeah, maybe. I mean, there are certainly some kids that have magical abilities that have also the diagnosis of autism.
Yeah.
So I think that is also true. But then you have a large portion of the kids that have very, very, very severe, debilitating, life-altering issues where they cannot live on their own. And that is where I think medicine and holistic practice really does come in.
Yeah.
It's not to, change somebody, but it is to help with symptoms, help a family, help to get them to function as optimally as possible, whatever that means for that kid and that family. And for some kids, that's going to be nothing. That means you don't have to do anything, because some kids are perfectly healthy and brilliant and much more brilliant, have some of these amazing skills, apparently, that we don't have. And I think that's really interesting too. But that's where I go back to, I think it's more than one thing. I think it's many things. And we don't necessarily want to stop some of these amazing skills, but I think there is a huge subset of those families that are having severe, and I know there's a huge portion of those families that would do anything to help their child to function a little bit better. And that's not to maybe take away these magical abilities, but to help them function in society and live on their own and not harm themselves and those kinds of things. So I think it comes back to, again, there's this need to fight these days, and there's need to have this dichotomy and either or. And if you say that we're working on autism, then you're saying that autism needs to be fixed, and these kids are. It's not about that. They're more than one thing going on, and we need to support the people that want to be supported. And if you're perfectly happy and your kid has super skills, great, that's fine. But that's not everybody, and we're here in medicine, I think, to help individuals that have a disease or a condition, or to prevent these things from happening, or to help support families however they want. And there are lots of families that need support for autism, way more than services available.
A lot. So your book before was talking about, parenting at your kid's pace. See, I have left the vaccines for a second. And you have some really beautiful points in your first book where you're talking about, parenting in a digital age. You have 2 young children. So maybe we could talk about in a perfect world and then in reality, right? Because I feel like there's a lot of things that in my house that we have figured out. And then people always say to me, what about like the phone and the thing? I go, forget it. I've completely failed that 100% of the time, pretty much. So because you're sort of in lockstep with being a doctor in this time, what were some of your constructive points to help people navigate raising kids in an electronic world?
I think electronics are here to stay. So I think that, we have to live in reality. I mean, if you want to move to the mountains and start a commune or whatever, that's fine. And that maybe it's better. I don't know. But reality, if you're here in a city, you probably have some screens. And as a pediatrician, I get the question often from parents like, oh, my older kid was watching TV and the younger one turned and watched it for a few minutes. I'm worried I'm destroying their brain. And, I don't think we need to be so worried about those things. We don't have to be so tough on ourselves. I'm more concerned when it comes to screens about what kids are not doing, especially when they're getting older. Now we're seeing the average being like 7 to 9 hours a day on screens. And that to me is the problem. If we're on screens so much that we're not outside, we're not moving, we're not playing, we're not socializing, that's very concerning to me as a pediatrician and as a dad. But for a kid to watch a couple minutes of a cartoon or to watch an educational program, or if you're on a vacation and you're on a plane or a long car ride, instead of screaming, is that going to turn their brain to mush? No, I don't think so. We all watch screens, and I don't think you need to be so worried about that. At least for me, I would focus on the big problem, which is this increasing amount of screens, being on there all day, being on social media all day, the stress levels that come with that, and the fact that we're not moving. That is the big problem to me. And I think I would focus there first, then on the kid that's watching 20 minutes of a cartoon. I don't think that the screen is the problem. It's just what they're not doing. And if you're sitting in front of a screen all day, then you're not moving, you're not exercising, you're not detoxifying. And that, of course, is a problem because we have to move.
You're very practical, and I just wonder because I have yet to meet a parent that's objective, right? Like people come to you every day, all day long, and you're helping them and giving them all this wisdom and, real information to help their kids. But you have 2 children. Are there times as a parent who has all this knowledge that you feel, overwhelmed, upside down, scared, like, oh, I don't know what to do?
No, never. No, I'm just kidding. Of course. I mean, you get that question a lot where, it must be so great. You're a pediatrician. And
no.
Okay, it helps in a way of, you know some medical stuff, right? So I don't have to be super worried about an ear pain or something like that. I can figure that out. But medicine is not parenting. So it really doesn't have almost anything to do with that. And when it's your own kid, everything goes out the window anyways. And a lot of doctors are, I'm not so much this way, but a lot of doctors certainly are very nervous about everything because they know the worst case scenario. So it's sometimes a detriment to be a doctor because the kid has a cold and you're like, oh, it could be a RSV. Oh, it could be you're like, you get super worried because you know too much. So yeah, I think that at times being a parent really is very different, or most of the time it's very different than being a doctor. So it doesn't really prepare you any differently than any other parent. You just figure it out as you go. But I think that it's interesting sometimes because you you know the development, you know the milestones, and it's like, oh, my kid's doing this at that time. Okay, it really works. Like the things that I say, like you see some of these things, and I think being a parent certainly helps you to be a pediatrician because you have more understanding and more empathy of the worried parent, why a parent might be worried, why they might be concerned about this thing because you just went through it with your own kid and now you're worried. So you kind of see that, like, oh, it's not silly that they're worried about that. Like I think it just helps you to have that perspective.
Yeah, it's comforting to know though, because I think, parenting is the most humbling job that there is. And like you said, the only way is to go through it. Now, with your second, there have been things that are like so noticeably easier for you?
Well, I mean, I find that talking about the second book is actually easier because people are so interested to talk about vaccines. And I feel like I can be more authentic now because
the whole picture.
Before, I feel like it wasn't about the whole picture, but also really watching what I say versus now. I mean, I still watch what I say to some degree, but have to be really careful not to talk about vaccines before because you literally say the word and it would get censored.
You get hammered.
And it's not like that anymore, which is crazy. It just changed recently. But I mean, even if it was that way, I think that we live in a different time now where there are podcasts and social media is not shutting it down. And that makes a difference because if you were to do a book like this before, you'd have no outlet to get it out there. Not really. Because, this isn't going to get on any mainstream things anytime soon, probably. But that's all there was before. And,
you never know.
Well, we'll see. I hope it does. My true hope is that I would be on, and I've been on a few things, but like talking about vaccines on like
the
CNN, MSNBC, the Today Show, and like
Yeah.
having these conversations there. If we get there, we're going to be in a much better world.
You talk about resilience in your first book, and besides being, it feels to me one of the most important things we could be in life is adaptable and resilient. And how do you approach that, not only in your practice, but like in your own house?
To me, being resilient is just trying to live a healthy lifestyle as much as possible. So the big things for me are food. We do everything possible to get the best quality food and make as much of the food as we can when we're home. We make every meal when we're home, and we go to farmers markets and get from a store that basically gets everything from a farm and it's vetted. So we try to get as much healthy, nutritious food as possible. I try to move, every day. I go for walks every day at lunch, and I try to minimize my stress as much as possible. And I think that makes a huge difference.
How does that show up for you? Because you don't seem like a particularly stressed out person. Is it just been being overscheduled?
If I feel like I'm getting overscheduled, there's too many crazy things going on, then just minimizing the schedule back or just stepping back and making sure that I get outside of that or do something fun for a little while to minimize the stress. I don't get stressed out that much, but certainly at times my schedule can get crazy.
What's fun? Like, do you have a hobby?
Several, but like just being with family, going out with friends, coffee, good food, traveling. Traveling is probably the big one.
With two little kids, right?
Now it's mostly traveling.
I always love,
yeah.
Like I can remember coming home like from trips when my girls were younger, and everyone just looks completely wiped out, especially Laird and I. It's like, did you get that bag? Did you get this? And the one kid's screaming or 50 feet behind.
Yeah. We've adapted this year, so we haven't really flown. I've flown to do things, but we haven't really flown as a family much. We've just done a lot of driving trips, which in California you're lucky because there's a lot of good places you could drive within 3 hours. So we've been able to do plenty of trips, but not flying trips yet. That'll maybe next year.
In your practice, you've talked a lot about prevention over treatment. So these lifestyle components being as a preventative, I think sometimes we're so prone to go, oh, we'll deal with the symptoms, not the root cause. We'll just, treat it as it is. But really reminding people that a lot of times, I've shared this story a few times. I was with this woman and she was here, and Hoist Gracie was here. He's a jiu-jitsu expert, and Laird was here, and she was interested in jiu-jitsu and surfing. And in two different conversations, not near each other, she said to Hoist, like, what if a guy comes up and grabs you around the throat and does a thing? And he says, Just don't get in that situation. And then later she said to Larry, like, well, what if I fell off my board in the whitewater and the wave and this and that? And he goes, yeah, just avoid getting in that situation. And sometimes I don't think we give enough because it's invisible to the power of prevention.
I think it was invisible. I think it's not invisible anymore, which is good. It's very hard to get people to do something before they're sick.
Yeah.
But I think that so many people are sick and it's everywhere right now. And there's so much chronic disease, overweight, obesity, diabetes, that we have gotten to this place where more than the majority of people, I think at this point, are aware of it. And that is why we have seen this movement, MAHA, whatever you want to call it. And whatever people think about RFK, whatever they agree with or don't agree, the one thing that for sure is going to be good that's going to come out of what he's doing is a focus on prevention. Mm-hmm. He's always said that, and he certainly believes in that, and they're certainly working towards getting things out of food. And it's a big issue. It's a huge issue. It's not simple. It's not that we just get dyes out of food and that's going to be everything. We're going to be great. Like that's not the solution. It's one thing that's important of 100 things, but it does have to start somewhere. And the fact that people are even caring about this now is a huge step towards a movement to where eventually maybe we'll have a lot more local produce and a lot more local farms, and you'll have the ability to get fresher food, and most people will be prioritizing cooking food, and that'll be important again for having family time. Like these are the things that have to happen, but it's a big shift and it's going to take a while, but it comes from at least an acknowledgement that prevention is key, and we're so bad at it in America that we have some of the worst health in the whole world. And thankfully, we have identified that and we are talking about it, and that's going to make a big difference. It's not going to change this week, but we can make a huge difference in the next 10, 20 years, because you go back 10 or 20 years and it was so much better. Mm-hmm. So if we course correct a little bit, we will be a lot healthier in a few decades. And that's what we should be focused on, because it's not too late now, but it's pretty late. We should have done this a while ago.
I think what's exciting, and people don't realize it because it does feel daunting. And even I go through this in my own life when I want to make a change, and we forget that a little bit each day can be very impactful. Mm-hmm. It doesn't, people may be what feels like really far from the kind of health that they're looking for, or vitality. But with these incremental changes, very small, it's not like you have to sacrifice all your joy and, fun of life to get there. You can make huge changes.
Right. We can make huge changes because the issues, for the most part, are things that have built up over years. It's not about eating a piece of cake today. It's about eating the crappy food over and over and over again for 10 years and 15 years and 20 years, and not caring when you go shop, and not looking at the ingredients, and not focusing on these things. If you just start to care, then you decrease that toxic load by 5 or 10% over 10 or 20 years. And that might be all the difference to keeping you healthy, or keeping your weight down a few pounds, or decreasing your risk for diabetes. And that's probably where we were about 10, 15 years ago. And now we have 10, 15 more years of not caring and not eating healthy and not focusing and sitting in front of a screen and all of these things that are keeping us unhealthy. And if we start to make little changes, it doesn't have to be overwhelming or daunting or impossible. You don't cook one meal. You cook one meal, cook two. Mm-hmm. You never look at ingredients, start to look at ingredients. You buy a bag of chips, read the back of the bag of chips, buy the better bag. These are all things that you can do. They're just very small changes, but we got so focused on, we were marketed to so much that we got so focused on faster, cheaper, easier. Mm-hmm. And what we lose out of that is health. And health has to be part of that equation when you make a decision. And it just stopped being part of the equation. We are doing everything for convenience and to make more money and to, what those other things that have nothing to do really with health. And it just has to get back to being a part of the equation. And if you buy everything with that in mind, then you will be healthier.
Yeah. And you talk in your first book a lot about leading by example. So when you have your patients or children, it's like the vet. I have a friend that I went to college with, and she said they didn't teach you about the pet owners, right? Like if I had known that, so you have parents coming in and maybe you can intuitively sense that maybe they're not as healthy. Do you have conversations with them and going, hey, listen, this is a lead by example. How do you broach that?
Yeah, I mean, for sure, we have conversations about food all of the time, and I think it's just very simple. Like you have to get that stuff out of your house. You can't eat Oreo cookies if you don't want your kid to eat Oreo cookies. So you have to take charge. You're the parent. You have to decide what you're going to have in your house, and you do have a lot of control over the food that you bring in. And I think parents sometimes need to just take back that power. And we also live in a time now where it seems that a lot of parents are worried about pushing back on their kids or being the parent. They want to be friends with their kid. They want gentle parenting. And while we don't want to be too authoritarian, but we do have to set boundaries. And I think it's really important for parents to be given the permission to say, like, look, it doesn't matter if your kid wants that thing. You know that it's not healthy for them. Don't buy it for them. You can get it as a special treat every now and again. Mm-hmm. But just feel comfortable that you care about their health. And you just say, we're not buying that anymore. We're not going to have that in our house. It's not healthy because of these reasons. And we're just not buying it anymore. And if you want to have it as a special treat, we can do it every now and again, but we're not. But if you eat it in front of them, it's not very fair to be like, I'm going to eat this, whatever, but I'm not going to let you have it. Like, It's not going to work. So I think if you lead by example, then they will do it. And it's actually not that complicated. Once you start eating healthier, you don't want to eat the other food. You just have to get out of that cycle, because a few weeks later, most of that stuff doesn't even taste that great to you anymore. You don't crave it anymore. You don't want it as much anymore. And that goes for your kids too. So you just have to get over that hump. And I think people are afraid of the pushback from their kid, but we can do it.
And
parents need just to be parents.
And listen, does it take a little more effort? It does, but I don't know too much more that is worth investing in. A little time and a little creativity.
Right. And I get the pushback all the time about, ableism or this. It's not about that. If a doctor can't talk about health, then why are we here? Like, yes, some things do cost more, but it doesn't have to cost more. There are many ways to eat healthy that don't necessarily cost more. And yes, it does take more time. And I get that everybody's busy and there are families that don't have the time, but we can't make that excuse anymore. Not really. Like, everyone's situation is different, but we also are at a place where 1 out of 2 kids have a chronic disease. So if you want that for your kids, don't do anything differently. Keep going in the same direction that we're going. But if you do want your kids to be healthy, we have to do something different. And the key there is caring and prioritizing health and finding time to cook, finding time to get healthy food, and figuring out how you can get the best healthy foods for what you can afford. And again, it goes back to, it doesn't have to be chips versus broccoli. It could be, you look at chips in the aisle, it could be the exact same price. You look at the ingredients, pick the one that has better ingredients. That's a health choice. And if you do that for everything, then we are in a better place. And there are lots of ways to get things that are actually cheaper, not more expensive. You can buy directly from a farm. They can ship you boxes. You can make some stuff at home. You can plant a garden. You can get some seeds. You can make sprouts. Like, there are a lot of things that you can do that are quite cheap.
Do you think Sarah surprised your wife how far you have come from the guy that she met at the hockey game?
Probably. Maybe a little bit, yeah. Yeah, she had a very specific view of medicine and health. And she was not against medicine, but just, grew up in a very more naturally minded family and just assumed of me that. And certainly it's a long road to go from there to here, because again, it's not that I wasn't interested or something in holistic health. You just aren't presented with it. So I just lived, just was, when I was younger. It wasn't really a part of my youth to really think like that. I wasn't overly unhealthy, so it wasn't really an issue. I wasn't sick all the time. I mean, I had like some mild gut issues, but nothing major that was really needing me to be focused on treatment. And certainly through medicine, you're just so busy learning that you're trying to just get all this information in that you're being taught, and you don't have any room or even thought to go outside of modern medicine. So, people sometimes say bad things about doctors, but it's like, these are good people.
Yeah.
It just, maybe we all don't know all the same information. And I really think that the more information that we are able to get out there, people are going to be open to this. I do think they are. I mean, doctors are certainly aware. There's a lot of pushback about vaccines right now. I see it in all the doctor chat groups. A lot of the mainstream doctors don't know what to do with this right now because they have so many patients pushing back.
How do you make the choice, or how do you decipher how to integrate some of these, other holistic practices into your practice? Because that must be an interesting process for you.
It is. I mean, it's not that hard because really it's about how serious something is. And the vast majority of what you see in pediatrics is pretty mild. So you have time. I mean, there are certainly things that need medications. And when it's serious, you would do the regular treatments. You can support it with other things. But I don't do anything differently than I would have done as a doctor. Just do more. And I think that's the difference. So if you're treating an asthma exacerbation, for example, you would do the same treatments, but everything else is not a serious exacerbation. So instead of doing nothing, or instead of just giving them a medication they don't need, you have other tools you can give them first based on whatever has some research or data out there. And it just gives you a lot more tools to use because 9 out of 10 times probably 99 out of 100 times when somebody comes in, there isn't anything that you have to do. So at least you're having some supportive mechanisms. And I think most parents like that.
You're a gift, Dr. Gator, and I know you're a gift to your patients. And I really appreciate your second book. It's Between a Shot and a Hard Place. And maybe just remind people all the places they can find you, or if they want to find your book. I know it's self-published, but did you do Audible?
Yeah. So you can find me at Dr. Joel Gator on Instagram or X. The book is Between a Shot and a Hard Place. You can find it wherever books are sold, or
Does Amazon have it?
Yeah, they have it. So theshopbook.com. So it's interesting. I don't know if you want to take 10 seconds, but
I do.
You can't get this book published. I mean, maybe there are a couple of publishers that would have done it, but basically nobody would. I mean, even when I told my agent about it, she was like, yeah, I can't do that. And she's a great agent. I love her. She's awesome. But she was just like, yeah, I just can't take that to the main publishers. And that's so unfortunate that you have book. And I said this to her, I was like, you and other agents, you probably represent like rapists and murderers and all of these things that can get books in Penguin. But like a topic of vaccines, you can't even present it to them, which should tell you how crazy this topic is, because that makes no sense. They didn't even know what I was going to talk about. Could have been the most pro-vaccine book ever.
Yeah.
But it just not something that they're going to be willing to do. So, it's great. There's a lot of great, like self-publishing is still work. You get all the same stuff. It doesn't actually matter that much anymore, but it's self-published, but everything else is the same. I mean, it's audiobook, all the regular places. So
how was reading it for you?
Reading it?
Yeah. Like, no, I mean, when you're doing an audiobook.
I've done some of it, and then we have a narrator to do some of it too.
Oh,
yeah.
Okay.
So, but it's fun.
Is there any last invitation? You see children every day, and parents and families. Is there any just last reminder or invitation you want to make to people? Maybe something I missed that is sort of always burning and important to you?
One, I think that parents don't trust their gut anymore. And I feel like we need to. There's just so much competing information out there that I think it's really important that we get back to getting that information, but then synthesizing it and do whatever we think is best for our kids. Because at the end of the day, there is no one right way to parent. So I think that's really important. And then with all topics, vaccines or anything that is controversial, keep asking questions. Parent who asks questions is not a bad parent. You should not feel crazy or ashamed that you have questions about something you're giving to your kids. It doesn't mean you're not going to do it, but it's crazy not to ask questions. So I think that if you feel like you're alone out there, you're certainly not. There are so many people that have questions. I think most people have questions at this point, and I think that's very reasonable. And if we all start to ask questions and we bring it out from the shadows and it's no longer taboo, then we are going to get to a much better place, a much safer place. And we've seen this in so many other topics lately that the conversations are being had and we get to a better place. So don't be afraid to ask questions.
I really appreciate that. Sorry, one last. If you had a teenager, would you give them the HPV vaccine?
I'm not going to say what I would do with my own kids, but
No, not
people
your
in
kids.
office.
I'm saying like as a parent who, because to me that's an interesting one, and I think a lot of parents are scared and then get pressured, and they want to do the right thing. I just wonder. Let me just say this: as a doctor, what would be the best way to approach asking the right questions about that one?
It is a technically recommended vaccine. It prevents against cancer, so it is recommended. Just like anything else, I don't tell people what to do. I mean, you have to dive into the research and ask questions about the side effects and the risks and what's been going on. I think it's a longer conversation for sure. It's not a quick one because any vaccine. I mean, technically it's recommended, and that's the only thing that I can do. But of all the vaccines, certainly the teenager vaccines, that's the one that has the most controversy around it because of the concerns around autoimmune reactions that people have stated have happened. There have been studies that show that that's not true. There have been lots of studies that show that it might be true.
What do they say? You can always find a study to support, right? Your point
you can,
of view.
and other countries have had some concerns around it, but still ultimately it's approved basically everywhere. So it's still recommended. But people have to decide what they want to do.
Is it Japan that's taken out the MMR?
So Japan took the MMR out, but they put back the MR, measles, rubella.
Okay.
They'd use a different strain of mumps, so it's a different vaccine than we have, but they make mumps optional.
Got it. Justin always gets one question. What's your as somebody who doesn't have children yet?
What would it take to do a proper vaccine study, and who would be the ones to lead that? How do we start taking those steps?
That's a really good question. So it is very the ultimate difficulty with a vaccinated versus unvaccinated study is the ethics around it, and this is where the issues, at least the mainstream bodies, say that there are such issues doing ethics because you can't not vaccinate kids. Right? You can't give vaccines to someone who doesn't want them, and you can't not give vaccines to someone who does. And you have an ethical concern that you're not giving someone the standard of care. So because the studies weren't done, I would say, in the best possible way originally, we're now kind of stuck because you can't do the studies you should have done in the first place, now that these vaccines have been on the market for a long time. I mean, you could technically do it, but you probably would never get those ethics approved, certainly not in America. So the realistic only way to do it would be to do an open label trial, basically meaning that people could self-select whether they're going to get vaccinated or not. You wouldn't stop them from getting vaccines, but you would let them choose which group they were in, and you would follow them forward for a long time. There are some confounders there. So of course people live a little bit differently if they're unvaccinated, but even still, at least you're getting information. So that's what I would do. I would start a major trial, as many kids as possible. We did it with heart disease, like the Framingham study. So they have a study where they followed thousands of people for many generations, and even some of their parents are involved now, and they keep checking in with them. I think we need to do the same thing with vaccines. And who would do it? I don't know. Maybe the CDC, maybe some sort of external body that is funded or self. I don't know. The problem is it costs a lot of money. So who's going to have the billions of dollars to do that? I don't know, other than the government.
The technology guys, and
they could do it if they're so either you need people that are passionate enough to fund something with billions of dollars, because it would take that much, or you'd have to be the government or the companies.
Yeah.
The companies obviously are biased, so that's not ideal. They would not want to do a study that would prove that there are problems technically. So why would they do a study that might find problems? So they're not going to do it. The CDC could do it. There's still some bias there, but reasonably that's who would probably do it. And hopefully you could get some unbiased researchers running that. That's, hard because they're biased pro-vaccine, but it may be the place to go. Or realistically, yeah, that would be great if a bunch of people came together and said, all right, we're putting a fund together and we're going to do this study and we're going to follow it for the next 20 years or 50 years, and we're going to put billions of dollars into it. And I think people would. I mean, I think
I do too.
If you could get a seed of enough money, then people would also donate. But you would have to get really, really good research. It would have to be airtight, because every single thing that you did would be looked at with a fine-tooth comb. So you'd want a big mixture of people. You'd want super pro-vaccine people. You'd want some people that were anti-vaccine. You'd want the best researchers out there. You'd want independent groups, multiple of them studying this data independently. So that way, you have to take all of those things into account. So that way you couldn't say that this is a biased study. And I think that is possible and should be done because if vaccines are related to any sort of chronic condition, we should know that. So that way we can minimize it. It's not to stop vaccinating, but if it is related, why wouldn't we want to know?
Right.
And if it's not, then great. That's the evidence that you need to get people to feel more comfortable that they want to do it.
Yeah. I love that. All right, Dr. Gator, I could talk to you all day. I won't torture you. Thank you for coming here. And I appreciate having qualified people who are encouraging the conversation. It really means a lot. So thank you.
Thank you.
Thanks, everyone. Thanks, everyone, for spending some time with me. Hopefully you got something out of it. If you did, feel free to share it with your friends. And don't forget to like and subscribe. And also, I want to hear from you. Tell me what's working, what's resonating with you, and how you're getting it done. Keep going.